Who does this sound like? Who has the time? I work long hours, eat on the run, get little to no rest, and have lots of stress. At the end of the day, I have family responsibilities, research, records, bills. Just about everybody today. Would you expect that from your doctor, your GP, your family practitioner, pediatrician? You wouldn't want to hear that from them, would you? If you went to the doctors and you saw this, would you want to take instructions from a doctor who was obese, smoking cigarettes, drinking 0 sodas, and had food smeared all over their jacket? Would you want to hear from them? This is not blood, people. It's ketchup and chocolate. Would you want to hear from a doctor who, when you see their waste paper basket, has candy wrappers and Coke cans and cookies and junk food? Or would you want to take instructions from someone healthy appearing who would advise you how to live a healthy life and share with you how they're doing? I think we all know the answer to that question. I wanted to have a bit of clown on me, and so I wanted to use the shock element to kind of get your attention, draw it in. And now, if you don't mind, I'm just gonna get rid of all the hot stuff. Yeah, somebody who knows me saw me walk in and they wondered what happened to me. Oh, I had you do that. Now I want to take this off. Can I just do this? In general, the studies indicate that physicians are less likely to be overweight or obese than the average American, but they're not immune to what's called the tight white coat syndrome, something I was trying to demonstrate. Due to the long hours, the high stress, and meals on the run. Dr. Cragen, age 59, professor of medical oncology at Mayo Clinic, says most of us commit suicide with a fork than with any other instrument. As physicians, we are advocates for our patients' health and well-being, and if we cannot be advocates for ourselves, doesn't that diminish our role as physicians? How can we expect our patients to follow our recommendations if we're not willing to try to do them ourselves? Shouldn't we be good role models? The do what I say and not what I do role doesn't work with parenting, and it doesn't work with doctoring. What we need to do is make exercise a daily priority, just like brushing our teeth, daily shower, prayer, Bible study. Everything we do must be prioritized and scheduled. There's just not an option. And I thought I had enough copies, but I may not have some statistics here for you. Several surveys and polls and questionnaires that I reviewed showed that physicians, as I said, are leaner, fitter, and living longer. They're less likely to be obese and overweight. In Canada, the doctors on average exercise 4.7 hours per week out of surveyed 3,213. 50% of 2,115 Harvard Medical School doctors said they exercise 3 times a week for 30 to 60 minutes. And I know for those critics who want to question surveys and stuff, we know that when we answer questionnaires, we can be biased. So we're not sure that those are true answers, but that's what we're going to believe. Physicians' health studies show that health practices of some 25,000 male doctors since 1982 found that those who exercise daily were only half as likely to develop type 2 diabetes than those who didn't. In 2007, 35% of 19,000 public health service doctors were at a healthy weight, 40% were overweight, 23% obese. And we already talked about the fork being the instrument of suicide for doctors and for many people. I'm just bringing up smoking because it's something we've seen a major decrease in, but the statistics show that 2 to 4% doctors smoke cigarettes. I don't know what else they're smoking, but they did indicate cigarettes, compared to approximately 24% of the U.S. population. And female doctors there's been an 83% quit rate, which is 2 times the that physicians are taking the lead in many areas before they're teaching their patients. Stress is a great factor for many doctors, and under great pressure, 763 practicing physicians in California, 53% of them reported moderate to severe stress. Only 38% of them reported their daily stress as light. 13% used sedatives or tranquilizers, and only 1/3 reported little or no exercise in their daily routine and poor sleep habits. In a 2001 survey, and we hope that this has improved since then, I just read lots of different surveys. Duval County Medical Society, 70% of the doctors will encourage their patients to exercise. Only 40% of the doctors regularly exercise themselves 3 times a week. And then the standard is that it's a regular exercise that they do for 3 times a week. So I wanted to share some of the statistics with you. Doctors maintain busy practices, and they do stay active in their families. I wanted to give you 3 examples that I read about. One physician said that the way he did it was get up early in the morning and exercise before he started his day. That was the way he could have better feeling about himself, have a brighter mood, feel lighter, and go into the day with more energy. Another family physician said that at the end of the day, she would cut her practice off a half an hour early and then have her husband bring her children to the practice, and they would walk or go swimming or go to the gym together. And she found that, you know, shortening her day by half an hour and exercising with her family did a couple of things. It would bring the family together. It's teaching her children. She's a role model for her children, and she would have more energy and feel better about herself and about teaching her patients what they need to know about exercise. My own example is that my office assistant and I take a break halfway during the day. You know, it's not always as long as I'd like, but we walk for 10 to 30 minutes, and that's when we do our business. We walk and talk. That's what we call it. We have a walk and talk time. And often patients catch us as they're pulling up for the next appointment, and we make the last loop around the complex and we get into the office. So it can be done, it's just that it has to be incorporated. I mean, it's on the schedule. We walk, we pray, and we eat our lunch at that time. So, as I said, it has to be prioritized and the schedule not an option. Because if we leave it, then we're never going to get to it. I wanted to tell you about an experience I had when I was much younger and single. It was much easier to do things. You know, we have all these obligations as we mature, as we grow up, and we have families, and we have businesses, and we have lots of things to do constantly. When I was in my first practice and I worked for the government, I was in a migrant farm town, small town. They had no gyms, they had no YMCA. It was a migrant farm population. The men worked in the field, but the women were home, mostly with their children, and they cooked and they cleaned and they didn't get any exercise in general. So, and they were used to prescription medicine. They went to the doctors. If there was something wrong with them, they used to get a prescription. That was the way they, and so I saw the need for changing the way they lived. And I actually started an exercise program. I got permission from the local school to use their gym. We started with a few people, and then before I knew it, the whole town was exercising. It was exciting because, you know, there's a thing about changing a village or changing one person at a time. I got to see that happen. And the class size grew in numbers, but diminished in size. It was really brilliant. And I could teach them that they could eat things. There was a place called Blueberry Hill that had the best pies, and often patients would find me and my assistant in there, and they would be like, "How can you eat that?" And I said, "Because I exercise. I mean, I would treat myself once in a while." So then they could see that you can indulge once in a while if you have a balance. The New York Times did an exercise in-depth report, and the things that they point out as good lifestyle choices, and we are aware of a healthy diet, regular exercise and keeping our weight normal. The second most common preventable cause of death in the United States is inactivity and eating the wrong foods, which leads to chronic disease. In case you don't know what the first one is, it's smoking. Many studies show that doctors who exercise and watch their weight are more likely to counsel their patients to do so and to be more credible. There's a strong link between what doctors themselves do and what they tell their patients to do. The American College of Sports Medicine revealed an annual estimate of 250,000 premature deaths in the United States directly related to physical inactivity. It's a serious problem in our country. The increase of the sedentary lifestyle in front of the TV, in front of the computer, the types of work that people do now, is further attributing to the current 203.3 million Americans being overweight or obese. Most individuals are aware that exercise can help them achieve improved health, but they're unable to make the behavior change to become more active. And the reasons they use are lack of time, motivation, energy, insufficient resources as the conflicts that, with their ability to exercise on a regular basis. We've all heard ourselves say those things, probably not Jason, but. Thus, we are challenged as practitioners to go beyond providing awareness. Just making people aware of these things. Most people are aware. What they need is someone to guide them. The reports have shown that 80% of individuals report to their doctors as primary care, as their primary source of health information. So 80% of people are relying on doctors. And nearly 80% of American adults see the doctor at least once a year. And still they're not receiving routine screening and health habit counseling. If patients are given written materials along with physician counseling, which is the key, along with counseling on smoking, diet, exercise, they're more likely to read that material, remember the information, and share it with others. Counseling a patient about healthy habits positively influences a patient's health practices. I have an example recently of a young woman, a 21-year-old, who had been smoking and wasn't able to quit. And I do the same sort of thing with dietary changes. I challenge the patient for 2 weeks, which is a small increment of time. It's doable. I will give them a challenge to do for 2 weeks, which they come back to the office and follow up. I gave her a challenge to stop smoking with support. And I often challenge patients. Often people come in with all sorts of problems, constipation. Here we see a lot of sinus problems, mucus production, joint pain. I'm trying to think of other things. And the first thing I ask, and I look at their dietary intake as part of my screening, is do they do dairy products? And I ask them to go off dairy for 2 weeks. And because of the positive results of that, they come back with improved bowel function, less mucus production, and diminished joint pain, and other problems. They are willing. They have had they've had a brief period of this trial, making a change in their life, and they've had success. So they're most likely to then go on to pushing it further, trying the next thing by doing it in small increments. So patients are willing to listen, and clients even, if we start with small pieces, a short amount of time, we give them definite instruction, and we follow up. The doctors, and I think everybody knows these benefits of exercise, but the reason I would address a patient, and we should be addressing everybody, even from youth. But the major reasons we look at prescribing exercise to patients is weight loss, muscle and bone strengthening, in the youth for healthy growth, and in mature for prevention of disease, rehabilitation for the improvement of flexibility and strength for range of motion, to improve cardiovascular function, respiratory, lymphatic, digestive, and to improve their glucose metabolism, to avoid and diminish the risks for diabetes, to improve mental well-being. All the studies show that exercise decreases stress, anxiety, and depression. I will not write a prescription. I would try these things first before giving someone a drug that could have a lot of side effects. And again, like I said, if we try it for a short period of time and they get to experience this increased well-being, feeling of energy, they're more willing to push further and go longer. It improves sleep patterns. So many people today have trouble sleeping, getting to sleep, staying asleep, but their bodies have not been exercised enough to be fatigued, or they can't shut their minds off. And exercise has been shown to help in those areas. And then the thing that is most amazing to me, and I just think we have completely forgotten, it goes along with the sedentary lifestyles, that all of the studies are showing that exercise decreases the risk of cancers. The major ones are colon, breast, endometrial, and prostate cancers. Because of the effect on the hormones of the body, because of the transit time in the bowel, exercise influences the body positively, so we can see a decrease in these cancers. We can prevent them. The type of exercises are varied, and we know that everyone has a special thing they like to do or things that they don't like to do. And so we need to be very aware of that. We can't give a prescription for an exercise, something you're not going to want to do, and you're not going to want to do it very long. So we think of all the different kinds. Walking. Some people like to jog and run. I don't like to do that. I like to walk at a brisk pace. Some people like to hike or stair climbing. Some days I feel like I didn't get any exercise. And then I remember, I have stairs in my house. I'm up and down those 10 times a day when I'm at home doing housework. Gardening, mowing, raking, planting, shoveling. Those are all really good exercises. Cleaning the house vigorously. Let me tell you, when I clean my house, I'm sweating. Dancing. If you love to dance, then you should dance because it's really good cardiovascular and fun. Cycling, a lot of people like to cycle. Swimming, aqua aerobics. Of course, we need to consider weight-bearing exercise, so weightlifting, or just, at home, carrying the basket full of ironing or the laundry up and down the stairs. Tennis, racquetball, golf. Stretching is so important. I would say that we don't stretch as a people. We don't stretch. We don't stretch with four-way exercise. We don't stretch afterwards. We don't stretch. We get in trouble because I'm going to show you we're sitting. We sit like this. We're sitting, and then our bodies become shortened and tight. And then when we go to get up, our backs have become tight and short. Our legs are shorter. Our necks stick out in front because we're at the computer. This is our stance. And then we have back pain and neck pain and sciatica because we're compressing everything as we sit all day long. So stretching and breathing is really important as part of the exercise prescription. Fishing, even fishing is good exercise. Being out on a boat and moving is good. And of course, cross-country skiing, which is a big pastime here in Texas. Just making sure you're still awake. In February of 2012, the CDC reported that more patients are getting prescriptions for exercise from their doctors. 1 in 3 adults are being advised to increase their physical activity as a means of improving their health. And this is a significant increase since 2000, when less than 1 out of 4 were offered such advice. A 2008 study showed that overweight patients were 5 times more likely to exercise if their doctors counseled them to do so. We are obligated as practitioners, and it's not just physicians, nurse practitioners, physical therapists, anyone who is advising people. We need to go beyond making a patient aware. We need to make it an essential part of the treatment plan. It is time to prescribe exercise as part of health treatment for every patient based on their needs, considering their preferences, their health status, their motivation, and then following up on a regular basis to encourage them and assess their progress. The prescription itself can look like anything. It can be a plain piece of paper, or it can be formed. When I refer people to the physical therapist, it's very well outlined, and it's basically what we should be saying. We need to write the type of exercise, the duration, the intensity, and the frequency. I just want to make sure we haven't got anything about the patient prescription. So in summary, we need to make exercise a non-negotiable part of the daily routine. Again, like brushing our teeth, or taking a shower, or saying our prayers. We need to be accountable to someone. That means us doctors too. We need to be accountable. We need to make our patients accountable. And we need to record progress. I buy really inexpensive notebooks, the dollar store, wherever I see them on sale, and I hand them to patients when I give them the challenge, and I ask them to write everything they put in their mouths, everything they do, if they have thoughts, emotions that day, and come back, and really it's for them, but if they can bring it to me, we can talk about what happened this day when I didn't exercise or I didn't follow through on the diet. Then we can look at what kind of emotional things or distractions or what's helping them be defeated. It also is positive, because then they can see, oh, look at this. I did this for 2 weeks. I can do this. Referring to exercise therapists, personal trainers, physical therapists, I do that. I've referred patients. My own son with special needs has gone through a program with Jason, with both the Jasons, I think. And that is when I write a prescription for a patient, I may just begin to challenge them. Like this new year, I'm starting to ask patients, what are you doing? How are you exercising? Let's look at your program. And what is it that you need to cut out in your diet? I mean, my screening questionnaire for patients includes all their behaviors, their diet, and I can look at it and see what they're doing. But I've become more aware doing this research, thank you, Jason, that I need to become more specific with them. I need to look at the details of their exercise program and really encourage them. And so, but I don't have expertise or the time to take them out like I did when I was young in my first practice. I'd love to, but we have so many resources here in Katy, just in Katy alone. So we can send people to the exercise therapist, the personal trainer. People are a little nervous about this because then they think they're locked into a program. But again, I write it for a period of time. They know that they go so many times a week, and then at the end of that time, they're going to report back to me and tell me how they feel, how it's helped them, or what they gained from it. And then I get feedback also from the various therapists. We do this for prevention of injury. I've sent people who haven't gone skiing for years and want to go skiing and not break a leg or injure their hip, and I've sent them to the therapist for building up muscles, because there are muscles they haven't used in a long time. Or in the case of my own son who had surgery and needed rehab, people who need rehab or just strengthening, people whose core muscles are weak. People like I demonstrate from sitting all the time at their office and have no idea how to begin. One of the things that I discovered that you might be very aware of is the Exercise is Medicine initiative, which was started in 2007. Prescription for exercise. There's a website on AIDS for practitioners. The partners of that are the American Medical Association with the American College of Sports Medicine, along with the President's Council on Physical Fitness and Sports, and this one I wasn't sure about Coca-Cola. Okay, I'm glad they're in on it, but I'm not sure that they promote the best. Anyway, their belief is that regular physical activity is important in the prevention and treatment of diseases and should be assessed as a part of ongoing medical care. The prescription to help prevent and treat many of our nation's health problems, improve self-image and mental health, is exercise. It is essential to include when considering a patient treatment program. The doctor writes a prescription, and it should be a menu for the patient. They should be able to choose from a variety of things. It should be appealing to them. So variety is key. We make a list of activities that the patient likes and can choose from rather than the same thing every day. And most of the studies now are showing that mixing it up, keeping it varied, keeps the person motivated, also exercises different groups of muscles. So our goal is to go beyond awareness, to actually give the patient the prescription and then guide them to the people that can help them if they're not knowledgeable or haven't had experience themselves. And so, what doctor do you want to go see? I don't think we want to see the doctor who sits. One of the articles I read was a medical student who followed an obese, smoking physician who carried around a six-pack of Coke all the time, and like my example, had snack food sticking out of his pockets and had it in his wastebasket, and he sat there and wrote a prescription for a patient for blood pressure medication because his blood pressure was high, and told the patient to lose weight, and the patient said, "Are you kidding me? Have you looked in the mirror?" And when he walked away, the medical student saw the patient throw the prescription away and hear the patient mumble, "Has that guy even seen his feet lately?" That is not a good image for doctors. We cannot get away with just telling the patient what to do anymore. We have to be the model. We have to practice what we preach. And so that's what's happening now. Doctors are changing, and hopefully we will make a huge difference, because as we read and have learned, our country is in trouble. And where the tool we use to kill ourselves is not the gun, it is the fork. Thank you very much.